Andrew Wanjohi makes a daily trip into an isolated clinic at the Kenyatta National Hospital's compound. He is being treated for an ailment that is relatively new in Kenya but which is fast spreading. He is suffering from a strain of TB that is resistant to the first line of treatment, known as multi-drug resistant TB. A disease that doctors worry may soon get out of control if a special drive to deal with it is not put in place.
As of end of last year, we had about 550 confirmed cases of MDR-TB in the country. So far, only about 230 of those diagnosed with MDR-TB have been put on treatment.
Unlike many ailments, sometimes patients with this deadly strain of TB appear quite healthy.
Because basically, MDR-TB is a diagnosis of the laboratory.
Wanjohi says he was treated 3 times for ordinary TB before it was discovered that he had developed resistance to the drugs.
I have been on medication for the last 1 year. And medication means I've gone through injections for 8 months every day.
Indistinct as it may be, it is crucial to detect MDR-TB and seek treatment as soon as possible.
If you don't follow your treatment when you are at this stage, there are no two ways about it. The only way is death.
MDR-TB is, however, one of the most expensive diseases to treat. That's why doctors insist that patients strictly adhere to treatment. Otherwise, there is danger of developing a more incurable strain of TB known as extreme drug-resistant TB.
It costs anything between 2 million and 3 million. And it is a very lengthy treatment. It takes a minimum of 24 months currently in Kenya. It could go on and on up to almost 3 years.
The drugs I'm going through now are very toxic. They've got very many side effects.
If I'm around somebody with MDR-TB, are they likely to infect me with MDR-TB or ordinary TB?
They will infect you with drug-resistant TB because that is the bacteria they are carrying at that point.
Yet stopping the spread of this highly infectious disease is equally an expensive affair. Ideally, all MDR-TB patients should be put in isolation, at least until they are no longer infectious.
But that is not happening as yet in Kenya. So we are still treating them in our communities and not really putting them in isolation because we don't have those isolation facilities.
Infrastructure aside, ignorance and stigma continue to fund the spread of MDR-TB.
We would like them to wear a mask everywhere they go. But can you imagine entering a matatu with a mask? Everybody would stigmatize you and probably throw you out of that matatu. So they just don't wear.
It would, however, help significantly if public service transport users kept their windows open at all times.
If there is somebody who is coughing in that matatu, everybody in that matatu is at risk.
Once you cough for more than 3 weeks, go get tested.
Fortunately, with treatment, patients like Alexander are no longer infectious and can now safely interact with other people. Sylvia Chebet for Sunday Live.